Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristen Jackson. Every week, I share my over 25 years experience to guide both men and women as they age. Listen as I discuss a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. It's happening to all of us, so listen for some solid scientific knowledge on how to handle these changes. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. What did you learn in sex education, if you had any, during your schooling? Sex education in schools is usually done during middle school age, when both boys and girls are beginning their sexual development. And of course, it's important at that time to teach children about the changes that they can expect as they go through puberty. Now, I could spend a lot of time talking about how I would improve Sex Ed 101 and how we teach young boys and girls about looking at sex and sexual changes over their lifetime. Because I think if we frame sexual education correctly when we're young, we end up with adults with much healthier expectations for sex and attitudes towards sex, and we can normalize a lot of what goes on during intercourse. However, what I want to talk about today is Sex Ed 202. What would I teach women who've been through puberty and now are young women? What would I teach them about what's coming for them later in life? Recently, I hosted a bridal party at my house. It was over a weekend, and it was a bridal party for my niece. Congratulations, Brooke and AJ. I had a large group of women her age, so young 20-somethings, as well as a group of women closer to my age, 50-somethings. These were her future mother-in-law and me as her aunt and some of our other friends in our age group. One night during the bridal party, we were all sitting around having a great time, and one of the 50-something-year-olds asked me a question in front of the entire group about her own personal menopause. And she was very open at sharing her experiences, and she had some questions she wanted to answer. I was more than happy to share my knowledge with her, but what I was really surprised about was as I answered her question, all the 20-somethings were really very interested, and they had tons of questions about menopausal transition, what they can expect, and what they can do about it. Both groups, the 20-somethings and the 50-somethings, said they really had no information about these menopausal changes, and they were both very interested in getting it. So in the middle of our bridal shower, I kind of held court, helping to educate both the younger women and the perimenopausal women about what to expect for perimenopause. And then I started to think, so what would I tell a 20-something about what's going to happen in her lifetime? So I've put together a list of what I would like 20-somethings across the world to know about what to expect over their lifetime. During your 20s, this is a time you might be concentrating on what's happening with your period. Is it regular? Is it too heavy? Is it too painful? You might be considering getting pregnant and you're worried about the ability to get pregnant, or maybe you're recovering from having your pregnancies. During this time frame, your hormones are cycling monthly, so they're rising and falling, and it's that rise and fall of hormones that creates the menstrual cycle every month. Most important, contraception is critical at this time if you are not trying for pregnancy. And what I found from my informal poll of the 20-somethings at the table is they were pretty knowledgeable about contraception. They knew about what was out there, they had talked to their gynecologist, and they were all comfortable using the contraceptive method of their choice. What they didn't understand is that their natural cycling of hormones during this decade was really protecting their heart, their brains, their bones, and their skin. A lot of what they experience as youthful health was really due to healthy hormone levels. What most of them didn't realize is that normal hormone cycling begins to break down in the mid to late 30s or early 40s. So even though we define menopause as a time 12 months from your final menstrual period, The symptoms of that change start as early as a decade before. So, any time in the 40s is prime time to begin to experience menopausal symptoms. And some women even begin to experience them as early as in their late 30s. The next thing I would really want 20 somethings to understand is I don't want them to accept the excuse, well, you're just getting older and that's how things have to be. Many of the symptoms that we describe as common aging symptoms are more accurately described as symptoms related to poor hormone levels. Fatigue, exhaustion, brain fog, loss of muscle tone, decreasing libido, muscle aches and pains, frozen shoulder, ringing in your ears, dry and itchy skin, sagging skin and wrinkles, dryness in the vagina, pain with intercourse, especially right at the insertion of intercourse, increased urinary urgency and frequency, increased risk of urinary tract infections. All of that huge list of symptoms is associated with waning or poor hormone levels. And I probably didn't even give you a complete and exhaustive list. That was just quickly off the top of my head. If young women can understand that that huge list of symptoms is associated with poor hormone levels, then maybe they will be more empowered to have their provider look into those hormone levels or replacing those hormone levels as a treatment for their symptoms. I really think about hormone replacement therapy not as medical treatment. It is simply replacing what our body can no longer make. I liken it to this. If you had a disease in your thyroid gland and you needed your thyroid completely removed, it would be a no-brainer that your physician would put you on thyroid replacement hormone for the rest of your life. There wouldn't even be a discussion about it. It would just start automatically. Could you live your entire life without your thyroid and without thyroid hormone replacement? Absolutely. But your quality of life would be so decreased and your risk for so many medical conditions would be increased that it would be seen as completely unethical to allow you to survive without the replacement of your thyroid hormone. It is no different when gonadal hormones begin to deplete. Gonadal hormones, I'm talking about estrogen, progesterone, and testosterone in women, and testosterone in men. These are the hormones that come from the ovaries in women and the testicles in men. So it doesn't make sense that when men and women begin to lose their gonadal hormones, their sex hormones, that we allow men and women to suffer the consequences of that rather than just seeing it as replacing what the body is expecting to have. In my opinion, proper hormone replacement should be available to all men and women. It should be available at the time they begin to experience the symptoms, and it should be supported for the remainder of their life because it not only makes them feel better in the short term, it also reduces their risk of disease in the long term. That is no different than replacing your thyroid hormone, which makes you feel better in the short term and reduces your risk of significant disease as you age. And what else would I tell the 20 somethings that they can do now to help them with their hormones as they age later? The most important thing that I've said over and over again, your best anti-aging secret is to maintain muscle. So I would tell the 20 somethings, exercise now, but concentrate on building muscle rather than getting skinny. Maintaining muscle as we age is the secret sauce to preventing so many things. Muscle is more metabolically active than other tissues, so the more muscle we have, naturally, the higher our basal metabolic rate is, and we're going to burn more calories at rest. That helps us to maintain our weight. Maintaining good muscle means that we are strong and flexible. That reduces slips and falls as we age. And we know that falls and everything that results from a fall is the number one reason why patients get admitted into a nursing home and all of the subsequent things that happens when you get laid up from a fall. You are sedentary, you're at increased risk for blood clots and pneumonia, and all of those things can really take a toll on our older patients. So preventing the fall in the first place is really critical, and maintaining good muscle mass means that we are stronger and more agile and less likely to have a fall. The next component to maintaining our muscle as we age is to make sure that my 20-somethings are eating well, but they're concentrating on protein intake and minimizing processed sugar. Again, the protein intake is going to help feed our muscle gains. You can't build good muscle if you don't have the building blocks of muscle, which are protein. If my 20-somethings can get into good habits now, where they are eating a high protein diet at every single meal and concentrating on foods that help grow muscle, it won't be as difficult as they age to continue to consume protein. And studies show us that we likely need to consume more and more protein each decade of our life. So if my 20-somethings can get into the habit of looking for those healthy protein sources now, then it will be easier for them to add on protein each decade of their life. The third thing I would tell them to do now is to mind their stress. We know that high and chronic stress levels, which means chronic levels of cortisol in our bloodstream, are really counterproductive to healthy hormone levels. And you can check out some of my other podcasts where I go deep into the relationship between cortisol and stress and abnormal hormone levels. But making sure that we have an appropriate stress response, we're not having cortisol levels that shoot up too high when we have a stressful situation, or that we don't have cortisol levels that are chronically high. They never fall. We're just in this chronic fight or flight mode. Both of those conditions are going to lead to unhealthy hormone levels and increased risk of aging. So thinking about things like meditation, yoga, even just walking outside in nature, listening to music, concentrating on breathing, all of these techniques have been shown to decrease abnormal cortisol levels. And if my 20-somethings, again, can get into the good habit of making sure that they manage their healthy stress levels and know how they respond to a stressful situation by making sure they increase their methods to decrease their cortisol, hopefully, once again, they're going to have good habits for their life of maintaining healthy hormone levels and maintaining healthy stress levels. I think, in addition to Sex Ed 101, which we get when we're going through puberty, we should also get Sex Ed 202. This should happen in our mid to late 20s, and it should educate women about what they can expect over the next 2 decades, and most importantly, how to prepare themselves, what they can do about it, what symptoms they should be looking for, and how they should demand the correct care for themselves rather than just being told, this is what happens as you age, or this is common in menopause. Because even though these symptoms are common as women age, it doesn't mean that we should suffer from them. And it certainly doesn't mean that we should accept the increased health risks associated with them for the remainder of our lives. So it might have been unconventional to hold a menopause talk in the middle of a bridal shower, but I was actually so excited to do it. And more importantly, I was really, really warmed by the positive response I got from the different age groups. I kind of expected the 50-year-olds to really want to hear this information because it applies to them at that exact time in their lives. But I was so excited to hear that all of these wonderful, intelligent 20-something-year-olds were interested in learning about their health as they age, and they wanted that information now rather than later. Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.